All right, well, people are filtering in, so I think we can get started. So welcome everyone from wherever you are in the US and beyond. We're excited to have you here today. Very excited for our panel today. My name is Rob Henry. I'm the CEO and founder of the 82 Alliance, and joined today by some of our speakers and also supporters that I'm going to introduce you to. But I just wanted to thank everybody for signing up, and hopefully you enjoy the dialogue. You can enter questions in the Q&A box. You can chat and share with us where you're from, what you do. We'd love to hear from you. Any feedback you have would be wonderful. We're focusing on looking at how to create a better tomorrow. As I think we've all seen in the pandemic, the one thing that maybe is positive that it's given us is a time to step back and think about what we've been doing and how we've been functioning as a society, and what we look at is the mobility options and the choices that we were making and how that impacted climate and health and many other factors, and the lack of equity that was out there. And so what we're working on is bringing people together, and we want to work with you. If you're in an area that's looking for that and needs assistance, please reach out, and we'd love to chat with you and kind of help you work through that and provide guidance. We're a nonprofit, so our mission is coming from that nonprofit lens, where we're here to basically work with you and bring people together like we've always done and historically have done in our other organizations. So hopefully we can do that for you, and we're happy to. So I wanted to also introduce, I have two of my team members on. Stacy's on the screen. She's kind of the back end moderating everything. And then Maureen Farrell, who's going to be managing the Q&A. And some of you may know both Maureen and Stacy, so thank you. And first up, I want to introduce Lois Demeester, the CEO of the Destination Sales and Marketing Group, to just say a few words.
Sure. Thank you, Rob. I appreciate that. Our firm is really proud to support Rob Henry and his team in this new endeavor that's 82 Alliance. Many of you may recognize DSNMG from our transportation demand management work with one of our major clients in Arlington, Virginia. Or you may have been involved with us over the years with Arlington Transportation Partners, or with our digital think tank, also in Arlington, called Mobility Lab. For many years, we hosted Transportation Camp in partnership with Transportation Research Board. So our vision in this next year through 82 Alliance and our partnership is to bring compelling transportation and mobility best practice subject matter to the forefront, and to convene panels like this, and perhaps publish occasional opinion briefs on topics that are really vital for new innovations for our smart cities of the future. So we really hope you enjoy today's webinar. And like Rob said, we welcome as much feedback as you can give us, and any ideas that you may have as we continue programming these vital webinars over 2021. So with that, I turn it back over to Rob, and we'll get started, and he can introduce our first panel speaker.
Thank you, Lois. Also just wanted to introduce quickly Steve Ray, the Senior Vice President and Principal of eConsult Solutions. Say a few words.
Thanks, Rob. Hi, I'm Steve Ray. I'm a Senior Vice President and Principal at eConsult Solutions. We're an economic consulting firm that really helps our clients answer their big questions and tell their story through insights, ideas, and thoughtful analysis. We work with state and local governments, nonprofits, transit agencies on economic analysis, and also do a lot in the smart cities, smart mobility world. So always glad to support Rob and the 82 Alliance in the work that they're doing, and look forward to a great panel. Thanks, Rob.
Thank you, Steve. So we have two speakers today. I'm going to introduce both now, and then we'll start with Ken and then go on to Steve. So Ken McLeod is the Policy Director for the League of American Bicyclists, and Ken leads the Bicycle Friendly State Program and databikeleague.org. He provides technical assistance to advocates working on state and local initiatives, and manages policy initiatives to improve bicyclist safety through vehicle technology and other traffic safety advances. He joined the league in 2012 after graduating from William & Mary School of Law, and he's a licensed attorney in the state of Virginia. He's also has a bachelor's from Sonoma College in Claremont, California. We'll also be joined by Steve Yaffe, the principal at Yaffe Mobility Consulting. Steve oversaw planning and operations for Arlington County's local fixed route and demand response transit until retiring in 2018. He has prior fixed route experience with RT Metro in Sacramento and Houston Metro, as well as paratransit experience with WMATA Metro Access Service and FastTran, Fairfax County's consolidated human service transportation provider. He's a member of the Transportation Research Board Transit Data Committee, is a past member of the TRB Paratransit Committee and co-chair of the 2019 TRB International Conference on Demand Responsive Transportation. He's also a member of the Fairfax Area Long-Term Care Coordinating Council and the board of the Independent Center of Northern Virginia, a center for independent living. He's also a contractor for Easter Seals and a grant manager for the National Aging and Disability Transportation Center. He also chairs the Transit Family of Services Committee and is the board secretary of the International Professional Association for Transport and Health, IPATH. So we're very excited to have both of them here today to give us an overview, and I'm going to turn it over to Ken.
Great. Let me just share my screen and get my presentation going. So I'm Ken McLeod. I'm the policy director at the League of American Bicyclists. Really excited to talk about biking today and some of the initiatives going on, particularly at the federal level, that can improve biking and bring about a better tomorrow. If you're not familiar with the League of American Bicyclists, we are a national nonprofit membership organization devoted to building a bicycle-friendly America for everyone. We have our signature event coming up in about a week and a half in the National Bike Summit. That'll be February 28th to March 3rd. Right now we have around, I think, 700 attendees, and we're really excited to get them all together, hopefully have 400, 500 people meet with their congressional members and lobby them on behalf of better bicycling. So I encourage you to check out the National Bike Summit, check out our website to connect with League member state and local groups. And I also want to make a plug for the campaign to get President Biden to commit to zero traffic deaths by 2050. This is something that the National Safety Council and Vision Zero Network and some other groups really spearheaded, like Families for Safe Streets. So they have over 1,000 individuals and organizations that have signed up to ask President Biden to commit to zero traffic fatalities by 2050. And if you go to zerotrafficdeaths.org, you can learn about how to join them. And I encourage you to join that letter, join that call, and ask your elected officials to do the same. So just want to get it out there. Why biking? For me, the fact that biking is fun is enough. But I think what matters right now in this moment is that investing in biking and walking gives you the most bang for the buck in terms of creating jobs. When you create greenways, sidewalks, and bicycle facilities, you create more jobs per project, more jobs per dollar than other transportation investments. So when we're thinking about building back better, what's going to stimulate the economy, biking and walking infrastructure is going to do that. And it's also going to improve our health. So many people have been affected by the coronavirus. Physical activity through biking and walking is some of the best things you can do to make sure that you are in a good physical situation for any ailment, but particularly important with COVID-19. So the more we can do to invest in biking and walking to have a healthier, happier society, we should do that. Which brings me to my framework for our work to make biking better for a better tomorrow, which is this Bike New Deal document that I published in 2019 with these 5 principles. So I'm just going to go through them and talk about some of the legislation that's happening at the federal level that speaks to these 5 principles. So the first one is connected, safe, all ages bike networks. We believe if we have connected, safe, all ages bike networks, people have more mobility options, more access to jobs, more access to needed resources. And so there are several current bills that could affect this. HR 463 is the Transportation Alternatives Enhancement Act. Transportation Alternatives is the largest pot of funding for biking and walking infrastructure at the federal level. And there is also a Senate bill, the Complete Streets Act, that would require every federally funded project to be a complete street. That would mean biking and walking investments are made in the regular course of creating streets with federal funding. Both of these would really go a long way to make connected, safe, all ages bike networks. I also want to highlight that there is a once-in-a-decade process happening right now in the update to the manual on uniform traffic control devices. This is the kind of engineering Bible for how streets are striped, whether it's a 6-inch stripe or an 8-inch stripe. So that can really have a profound impact on how crosswalks and bike lanes and other things are made. And right now is the time to engage in that. That comment period is open until until May 14th. It was just extended this month to give 2 more months of comments. So we really need people who want to advocate for biking and walking and even transit to weigh in on that process so that we can get good guidance that every engineer in the United States will have to make places better for biking, walking, and transit. The second principle is to complete some bicycle mega projects in the next 10 years. This is kind of engaging transportation departments in the kind of scale of project that they're used to. A lot of time biking and walking projects are small, and these massive DOTs are used to very large projects. The idea here is to engage them with very large projects. So there's things like the Great American Rail Trail, the US Bike Route System, and the East Coast Greenway that are gigantic projects that would be an incredible resource for people moving forward. So there were some bills introduced last Congress that I think may have been introduced or will be introduced this Congress and hopefully be wrapped into the reauthorization that's hopefully having this year that would create some funding for these big projects. And I also want to highlight that there's some interest in big projects kind of focused on highways that have divided communities from our last major infrastructure investment period. So there's a $10 billion program proposed in a Senate bill to make highway removal, capping, or mitigation possible in communities that have been adversely affected by those highways and don't have those safe biking and walking routes. So hopefully through these larger projects, through these DOT scale projects, we can really make some changes to culture that might not be possible with the smaller projects. For TDM, hopefully this is near and dear to your heart, better commuter benefits policy. So right now our commuter benefits don't really address active transportation modes. The Tax Cut and Jobs Act back in, I believe, 2017 suspended the current or the former bicycle commuter benefit. And we really believe that you should have commuter benefits that push people to more active modes, safer modes that are better for the environment. And so it's been great to see some of the bills that have come out recently. HR 1019, the Electric Bicycle Incentive Kickstart for the Environment Act, the E-Bike Act, would provide 30% of the purchase price of an e-bike as a tax subsidy for people who want to purchase e-bikes. There's HR 384, the Bicycle Commuter Act of 2021, HR 382, the Bike Share Transit Act, which would be the first federal definition of bike share and would make bike share eligible for transit funding. So there's a lot of exciting stuff here. I hope all of it passes. I hope all of you are interested in advocating on behalf of this better policy that'll get people on bikes, get people out of cars, and hopefully make sure that bike share is supplementing transit now and in the future. The fourth principle is the US being a leader on road and vehicle safety. So the US created things like the first new car assessment program, the first testing program of vehicles to crash into objects and other things and see how well those vehicles performed. But in the last couple of decades, the US has fallen way behind other countries. In my guess, we're probably about 10 years behind Europe in terms of the testing they do. Europe has been testing cars to see if they can avoid or mitigate crashes with pedestrians for at least 5 years. And the United States currently has no plan to do that. At the very end of the last administration, there was a proposal to update the new car assessment program, but that was withdrawn in the early days of the Biden administration. So I'm very hopeful that gets reintroduced and has better things than were in the last proposal. Possibly even parity or better than Europe, where they do detection for bicyclists. And they're even researching systems that can warn drivers if they're going to open a door into a bicyclist. So that's the type of thing I would love to see the US do, but we need to push them. We need to push Congress, we need to push NHTSA to make sure those things happen. And there's also a lot of interest and activity around automated vehicles, and we are very much engaged with that. But we need both the short term and the long term here to regain leadership on road and vehicle safety. And finally, the fifth principle is the League of American Bicyclists believes everyone should get bicycle education. So our goal is that in the future in the United States, by 8th grade, everyone will get bicycle education. This is something where we don't yet have bills that speak to it. We don't yet have agency activities that speak to it, but that is our goal. We've had bicycle educators since the 1970s, and we are looking for ways to get there. And we are happy to partner with anyone who believes in that principle. So just briefly, how does COVID-19 affect these things? I really think it adds urgency. You know, now is the time to build back better. Now is the time to make those investments. I don't think we've ever really made large investments in biking and walking to provide it in the way that we did for highways and car travel. And now's really a time to invest in a people-first transportation system. So hopefully this is a time where we build sidewalks in a more comprehensive way and we build bike networks in a more comprehensive way. And all of that will also really support transit, which has suffered greatly over the last year, but has also shown how essential it is to communities. So we also saw a lot of experimentation during COVID-19 where cities were adapting their streets to provide more space for people. And we also hopefully are going to learn some things. So we saw speeding increase. So I hope that means we're going to invest in traffic calming and streets that feel like you should go 25 when it's signed as a 25-mile-per-hour street. In this pop-up infrastructure, there was a massive experimentation, but that kind of value of experimentation isn't seen in things like the Manual on Uniform Traffic Control Devices, where it's a very cumbersome and intensive experimentation process for communities that want to implement better bicycle infrastructure. So I hope the last year will show our leaders that we should have a more proactive experimentation process in the MUTCD so that we can take advantage of all that interest at the local level. And then we also saw places that have bicycle and pedestrian plans, places that have planning capacity were able to do more of these adaptations and do them better and speak to community concerns, where places that didn't have those plans maybe couldn't do those same things. So I really hope we see more interest in bicycle and pedestrian plans going forward, and that the experience with these pop-up street changes influences that. So finally, just kind of what to watch for coming up. The last stimulus time after during the Great Recession, we really saw a good amount of the additional transportation funding go to biking and walking projects. That's what you can see with the little spike that is highlighted there. So it'll be interesting to see if we see more proactive policy that pushes for that investment in biking and walking, or if we see that naturally occur kind of in the way that we did back in 2009. And then I think it's also going to be very interesting to see just how much policy has changed, how much policy advancements are made on kind of these other things around safety, whether that's vehicle regulation or something like commuter policy. And then finally, where equity is in all of this policy. Just today, I'm very happy to bring attention to the House Committee on Transportation and Infrastructure, announcing a hearing on examining equity in transportation safety enforcement. That'll be next Wednesday at 11 a.m. The League has been working with the Transportation Equity Caucus on those issues. So it's really great to see congressional interest in that issue. I think there's data from the Department of Justice saying that 20% of interactions with the police happen initially from a traffic stop. So if we care about justice and equity in policing, we should care about where our federal funds are going towards policing. And a lot of that is in transportation. So I'm looking forward to that. And I think there is a lot of exciting stuff happening this year. And hopefully a lot of it goes to make a better tomorrow with more biking.
Thank you so much, Ken. That was great. Appreciate you getting the visuals on there and the facts. So we had a few questions come through. Just want to start with, you had mentioned with the benefit. So are there any bills that offer corporate tax benefits to offer bike commute incentives or reimbursements? And if so, could you explain how that works?
Yeah, so the Bike Commuter Act that is introduced in the House, HR 384, would bring back a version of the old bicycle commuter tax benefit, which was a employer provided tax benefit for biking and allowed a reimbursement for bicycle related expenses each month. The new bill changes that a little bit, puts it more in parity with transit and parking benefits, where either the employee or the employer can make that determination of the tax benefited reimbursement. And it also raises the amount from, it used to be $20 under the old program, and I think it'll be like 60 or 80 under the proposed program. So that would be a significant advancement. If you purchased a bike and you use that to bike to work, you could probably pay off a $700 bike with that benefit through that program over 12 months of use.
Okay, that's interesting. That'll be something to keep watching. So these this next question, it's from two different people, but they have a similar vibe, if you will, theme to them. So it's been fascinating. It was fascinating to see the communities of shutting down streets, doing parklets and providing more safety. I live in Philadelphia, and many roads, one road particularly was closed, Martin Luther King Drive, for just recreational, and you felt more safe. So paraphrasing a bit here, but the idea of those, how do you advocate for those type of pop-up projects to come to your region? So many, a lot of in Europe, and the successful promoting of cycling as transportation. So, looking at how can we go about doing that for our area, knowing that everybody on the phone is, you can't predict and know where we're all from, but if you could speak to that a little bit.
Yeah, I mean, so my presentation was very federally focused, and there are definitely federal issues in terms of pop-ups. That manual on uniform traffic control devices, if you have an engineer that doesn't want to do that type of thing, they can wave that in front of you and say, I can't do it because of this document. So in kind of the medium term, we need to make sure that experimentation and pop-up things are allowed under our federal regulations, like the MUTCD. But I would say in terms of advocating for it, it's, local advocacy, talking to your elected officials, talking to city council members. If you have like a ward or a neighborhood group, talking to them, just asking for it, showing your vision for what that street could be in your community and how it could help you and your family or your friends, just making that emotional appeal for a better world, I think can go a long way at the local level. And then at the national level, I'd love to see more federal funding that is flexible enough to fund those pop-up and demonstration projects. There are so many places in the United States that have never seen a protected bike lane, and it's really hard to go from not seeing it ever in your lifetime to making $1 million plus investment in a downtown Main Street that's going to change it forever. So bridging that gap with a pop-up, a demonstration, I think is absolutely essential in many places. And I hope that federal funding can be flexible enough for that.
Thank you very much. I think that covers, well, it looks like actually we have one more. And just ensuring we have enough time, obviously, for Steve, and we can always continue to take questions, but let's see, how is biking sector looking to be more accessible and racially equitable? Many bike programs are taking up public space and dollars, no attention to ADA. digital or banking access?
Yeah, I think in the bike share space, there's a lot of interest in that. There's things like the Better Bike Share partnership that speaks specifically to those issues and has a lot of good reporting about creating alternative payment systems or creating subsidies. I know that some of the transportation network providers that are in that space, like Lyft or, well, I guess Lime, are interested in figuring out ways to have more subsidies for people with lower incomes, people who don't have access to bike share right now. So I think there's a lot of interest. Both the Transportation Alternatives Enhancement Act in the House and the Complete Streets Bill in the Senate that I mentioned have equity components to make sure that there is investment in underinvested places, in places where people have lower incomes, where there's racial disparities. So it's definitely something that the biking community is interested in and concerned about. And honestly, I love to see some of that same interest in those equity provisions in the broader transportation space, where we often are making new highways to encourage suburban development rather than investing in lower income places.
Thank you so much, Ken. I'll turn it over to Rob. If there are more questions for Ken, feel free to insert them in the chat, but I'll turn it back over to Rob to introduce our next speaker.
Great. Thank you, Maureen. And thank you, Ken. Appreciate it. Next, we're going to turn it over to Steve. Here's another perspective.
Okay, thank you. And I appreciate the opportunity to discuss transit after COVID. By transit, I'm referring to a family of services, from heavy rail to light rail, bus rapid transit, express, limited stop bus, local fixed route bus and trolley bus, and general purpose, human service agency, and ADA demand response, as well as first and last miles feeders. We provide transit to reduce traffic congestion, provide mobility to those who can't drive, and enable people to be productive during their commute. Now, as you can see from the two green columns on the left, telework, along with compressed work weeks, already depressed ridership almost 8% between 2014 and 2019 before the pandemic. COVID plunged ridership to less than a quarter of 2014 levels before climbing up to 35% in the third quarter of 2020. And with vaccinations, this trend will continue, hopefully beyond 60% of 2014. But if we fully embrace structural reforms, we can do better. Next slide, please. So transit is learning COVID's lessons. Some of those lessons were hard. COVID accelerated our trend towards frequent service on fixed routes linking higher intensity land uses. Frequent, I mean 15-minute service frequencies or less, or 10. Transit added demand response connections for essential worker commutes in many cities. We're paying attention to social determinants of health. Let me get back to that frequent service for a minute. We need that on mainline routes, not just so that you don't need a printed timetable, but also for social distancing. Apps and other technologies tell bus operators and riders how many are on, how many can be on board when the bus is full. Frequent service is also key to attracting and retaining riders. Routes have been adjusted to connect affordable neighborhoods with medical centers. In several towns, transit systems are partnering with demand response providers for late night essential worker commutes. And there's a new trend, it's been going on for a few years. Medicare Advantage programs and managed care providers are buying rides to ensure that patients reach medical and rehab appointments, exercise programs, stores selling fresh produce. Paying for rides is less expensive than missed appointments and the failure to follow medical directives. Next slide, please. Transit and health professionals are collaborating. Transport and healthcare projects serve more people when transportation, land use, and healthcare professionals collaborate in the project planning and review process. A new guidebook's been developed for that purpose. The link's at the bottom of the screen. This communications guidebook includes tools, a recorded overview presentation with slides and notes, summary brochure, and a summary report. In addition, iPath is developing a different type of guidebook that offers metrics to measure success. Several chapters, including the one on transit, have been drafted. Others are coming. We need chapter reviewers. Please volunteer. Next slide, please. This is the structure for the rest of my talk. I'm not going to read through it because you'll see these headers in a minute. Next slide, please. Restoring trust. Transit needs the trust of our riders and of our employees. Trust entails that everybody wears a mask. Transparent barriers between the driver and passengers are being installed to protect drivers from COVID. Many transit drivers are also being protected by rear door boarding, use of contactless fares. Cash is expensive to collect anyway, or free fares. New standard operating procedures are in place and new equipment is being tested for interior cleaning, HVAC systems that remove coronaviruses through ionization, ultraviolet light treatments, and air filtration. These are being tested for different bus sizes and powertrains. Social distancing on board, again, we have apps to help. Transit's adjusting schedules and vehicle assignments to accommodate ridership demand by route. Next slide, please. Demand can be managed. The top spreadsheet adapted a strategy to minimize COVID transmission. This was published April 28th last year, in which employees are divided into thirds. Each third would work 4 days in a row and then shelter in place for 10 days. Something to keep in mind in case we get hit again by a pandemic. The second spreadsheet is a strategy to flatten the peak, not the COVID peak, but the traffic peak. By flattening the traffic peak and keeping it flat, we can enable much more social distancing in transit vehicles. Flattening the peak is good for general travel time anyway. Telework helps in that. And as a former person in transit operations, I'd rather operate 15-minute frequencies on a route all day, every day, than 7-minute peaks and 30-minute or worse off-peak service. You'd need fewer buses to do that and probably fewer operators. Next slide, please. Equity is measurable. 2 Delaware planning organizations have married their geographic information systems, GIS, and modal network overlays with neighborhood traffic analysis zones data, usually built on census blocks, from the US Census American Community Survey. They use this tool to measure travel time by mode to industrial and warehousing jobs, which are often entry-level, lower wage, healthcare facilities, stores selling fresh produce, and post-secondary education. And they do that by comparing the travel times from affordable neighborhoods versus middle and upper class neighborhoods, and from minority neighborhoods versus white neighborhoods. This comparison measures equity in the ability to reach destinations. You can download a toolkit on this process by going to the bottom of the diversity resource page at nadtc.org. National Aging and Disability Transportation Center.org. Next slide, please. Securing institutional support, still important, still a focus, even with the COVID bills that have been passed and are going through. Fares roughly covered, on average, 25% of transit operating costs pre-COVID. The rest coming from government sources or for private companies through financing debt. Public transportation operations are mostly subsidized locally, usually through sales taxes, sometimes property taxes or other sources. But sales tax and other revenue has also taken a huge hit in this pandemic. With fewer riders, we need to work harder to justify subsidies for transit, both to tamp down on traffic congestion and to transport non-drivers. Next slide, please. Structural changes, next slide, for future growth. Transit, again, is a family of services. It's not just fixed route. And again, we're morphing towards intermodal, multi-provider linked trips. which entails coordinated information booking and payment. You've probably heard of mobility as a service. The acronym is MAS, that's with 2 A's. MAS requires one local platform for shared ride and sequential use modes. By sequential use, I'm referring to car share, bike share, and scooters. MAS also needs one platform for information, booking, and payment using standard and accessible data formats and open architecture. By intermodal, I mean that public transit's retrenching again to offer frequent service on fixed routes for higher density areas, affordable income neighborhoods, yuppie, is that term still used? Neighborhoods, high density commercial, office, and mixed use transit oriented developments. Some quarters can have limited stop service and crosstown, single seat crosstown connections overlaid on top of local routes. The other areas, the less dense areas, can be served by fixed route, demand response, micromobility, and of course, walking. Nobody floats to a bus stop. By multi-provider, as first and last mile services are often provided by the private sector, such as Uber, Lyft, Transloc, Spare, via taxis, hopefully soon jitneys, that's another conversation. First, last mile accessible shuttles and circulators in less dense neighborhoods, as well as office industrial parks, can enable all of us to reach work, shopping, and school. Next slide. Healthcare and community life. Connections for transfers, I want to make this point real quick, can be quick. Those connections can be quick through use of GTFS feeds. Real-time GTFS currently available from fixed route service shows the number of minutes before the bus or train arrives. At the same time, so that your demand response can see that feed in time, so they arrive before the train arrives, leave after the train leaves. Regulations need to be looser, focused on function rather than form. For example, mobility wallet concept. The 120 federal and many more state and local programs that subsidize rides should enable the rider to choose their rides. And you see on this slide an icon for SNAP, Supplemental Nutrition Assistance Program. Every state and Native American tribe has an EBT card, an electronic balance transfer card, issued to every SNAP recipient. Money's loaded once a month. They spend it where they want. Can't buy Cheetos. It's only for, which makes a mobility wallet card a little less complicated, actually. A mobility wallet EBT card could be implemented statewide or by metro area. Some transit systems, such as the City of Los Angeles City Ride, already have taxi user-side subsidy programs for people with disabilities and older adults that use EBT cards just like this, and money values loaded every month. Because these are account-based, IRS commuter benefits could be also credited to the card. To answer a previous question, if your bike share system allows payment from that same EBT card, you could use that. You could use a comprehensive mobility payment, possibly combining bike share and transit. The Ventra is one of a growing number of transit smart cards that are already account-based and could be used as a mobility wallet EBT card. If you put a barcode on that card, you can serve the unbanked. 16 million adults, 7% of the adult population are unbanked, no checking, no savings, no money market account. 1 out of 7 adults in households with less than 40,000 in annual income don't have a credit card. With a barcode or a QR code, you could go to 7-Eleven, put down cash and add value to your card. Next slide, please. Mobility hubs, along with good scheduling, facilitate transferring between fixed routes and other services serving lower intensity land uses. Shuttles, microtransit circulators with geofence boundaries, bike share scooters, etc. This illustration was prepared for SANDAG, the San Diego Association of Governments. The design for a site will vary according to the transit modes available at the location, but generally these hubs should have safe, marked, accessible crosswalks at intersections. And if you have a mid-block crosswalk, it should have a demand actuated signal. It should be lit landscaping that doesn't let anyone crouch or hide unobserved, a coffee shop, diner, convenience store, something with big windows, because people feel safer waiting in a populated area than in isolation. Even better if one of those shops sells transit tickets or can add value to that mobility wallet account. Pull-out bays for buses and demand response vehicles, LED or illuminated electronic paper screens showing expected departure times, showing those GTFS real-time feeds, and shelters with space for a wheelchair user and lean bars for standees. Next slide. And I got through this kind of quick, but here's my pitch. Do you support health, land use, and transportation professional collaborations? We need help disseminating the Transportation Health Communications Guidebook. And we also need help, especially from you active transportation folks, because that chapter's not done yet, or those chapters, it's like 3 of them, developing a common set of metrics at ipathinc.org. Please join us. By the way, we're setting up our own virtual conference this year. Thanks for the opportunity to present Transits in Revolution. I should have put on a headband. Great time to join, jump in, guide progress towards mobility for all. Thank you. And now I can see that we have some questions.
Thank you, Steve. We will make sure you have that headband for the next Zoom. Maybe that could be a giveaway. So I know we may have some other questions, but just looking in the chat here. So I know you could probably see some of these too, Steve, but so do you want to just turn that over to, I'll turn that over to you, and would you like to field that? I was looking at the DOT question, but go for it.
Free service is gaining a lot of ground. Corvallis, Oregon has had free service because they pay for their transit service through a water tax. They figure people are paying on their water bill. Again, collecting cash is expensive. We actually ran one as an experiment while the EPA building in DC was being torn down. I helped the neighborhood organization design it, and we got funded to run 18 months while the new complex was being built. And it just wasn't worth it collecting fares. And it does take a lot of time. It slows the bus down. On the other hand, with intermodal multi-provider linked trips, then you've got a question of you're going to have to pay on the demand response side. Chances are it's complicated. It requires thought. The other issue from an operator is that if you pay for something, even if it's a small amount, you're more likely to value it and not try to stay on the bus as a place. There are people who try to live on the bus, basically. That does happen. How do you convince local DOTs and so on to a dedicated lane space? Math. I think, let me tell you a story, and this relates to the guidebook as well. I live in York County, Fort Mill, South Carolina. One of our interchanges has to be rebuilt over I-77. They came up with 3 alternatives to the original design for 160 going over 77, none with a decent pathway on it to get you over the interstate. The best alternative by far had a gap that would have required a zip line. If you get your pedestrian cycling advocates and your public health professionals involved in the planning process, which we did, you can come up with tweaks, and we did, that can give a continuous pathway to go over I-77 safely. But the math part is, it's too many DOTs are focused on vehicle throughput when it should be people throughput. And if you show the occupancy that's carried by BRT, you can make a case that that investment is good. Some states have developed prioritization measures that include that. Massachusetts is has a great one. Virginia's pretty good. It's just got to be evaluated on the basis of more than just vehicle throughput. Let's see. Bike advocates, we need to work together. Again, nobody floats to a bus stop. So it's important to, when you order buses, have have a bike or two on a bike rack on the bus, because there's a lot of intermodal trips. I saw it in Arlington. A lot of cyclists would ride the art bus. Did I miss any? I need to scroll down.
Steve,
was just,
staying on the topic of the guidebook, do people listening need to be a member of iPath to be able to help you? Especially, you said you needed help in the active transportation sections, that those are still unwritten. How do we get involved as a group here?
My email and my website start with the letter Y. So it's Yaffe, Y-A-F-F-E, just one E as in Frank, two F's, at Y Mobility. So that's Y-M, ymobility.info. Or you can go to the website ipathinc.org. I can connect you with the folks who lead the area in which you're interested in. Let me know if it's pedestrian versus cycling.
Okay.
There's about 13 different chapters actually are supposed to be written. And
Okay.
thank you, we do need the help.
Okay.
Oh, choice rider design. Wow, that's a good one. That's actually that's a good question. It's interesting because where has ridership crashed the most? It's on park and ride. It's on express buses. And they're not going to recover to the level that they were at. So are they still needed? Yes, just not as frequent, with not as frequent service. At the same time, those services should be running midday as well. They're more successful if you run a service midday and into the evening than if you just run peak periods. But the choice riders come when you're running throughout the day. And if it's a local route or limited stop, if you can run every 15 minutes or better, you don't need a schedule. People can choose, this is a productive way to spend my time and get to where I need to go. And that's why Houston led the way, and several other cities are doing the same thing on focusing frequent service on those corridors where they can just bring people in and keep them happy. As far as essential riders, it's a family of services. You need to connect affordable neighborhoods to where they need to go, medical centers, low-income jobs. That may be through transfers. People, a lot of people hate transferring, but that's transferring, if it's done right, is not that difficult and not that time-consuming. We just need to use those GIS tools to show that we can take people to where they need to go on transit. Microtransit, again, it's geofenced. There's 3 different ways of doing it. Some systems are many to one. We'll pick you up where you're at, or at a central meeting place point in your neighborhood, and take you to where to the transit hub. So that's many to one. Many to many is we'll pick you up where you're at and take you anywhere within that geofenced service area. The mode I like is many to few. We'll pick you up. If you're an ADA rider, we will pick you up where you're at. And we may, some others may walk to a central meeting point. We have to meet the need. And we'll take you to the transit hub. We'll take you to a grocery pharmacy. Hopefully somebody is willing to kick in to subsidize the fares. If there's a medical center in the zone or nearby, we'll do that too. We've shown, actually, Graham Curry out of Monash University wrote a paper with, can't remember the other author's name, that proved that many to few last. Before it was called microtransit, we've had these systems since 2004, probably earlier actually. The many to few ones are financially sustainable because you can group rides and get more productivity and lower the cost per ride provided. Many to many are competing with exclusive ride Uber, Lyft, and taxi. It doesn't make sense. And many to one, you're only serving one market. So yeah, I have an attitude on microtransit. The other issue is political, just to keep in mind. The cost per subsidizing a ride on fixed route services is lower than on microtransit. And it's, the differential is widening or will widen as more services concentrated on fixed routes and those buses are full and going in both directions. So there's a political issue that has to be surmounted. People have to understand to maintain that service area coverage, there's going to be a differential in subsidies. So something to keep in mind. Bike advocates, public space. It's not my topic, but public space is huge. Curb space is huge. Some transit systems have, like Boston Metro, I think, painted off a square for parking your scooters. That technique's being done, designated parking. But I can't speak too much to scooters because I'm too old to ride with those things.
Never. Well, now, thank you, Steve. I appreciate reading the comments and your insight. And I was curious, I had a kind of question for you, and for Ken, and thinking about kind of the change we've had in the federal offices, and you know, if there's one major policy change that you think, either of you think could happen this year. I know we have a long wish list of things we'd love to see, and working with government, things unfortunately take a very long time. But are there things that maybe one thing from each of you you'd love to see happen this year?
Ken, do you want to go first? Because I actually have two.
I mean, I was thinking I had three. I think the thing that I would be really excited to see is movement on the new car assessment program, that vehicle safety piece. It's something that there was a regulatory move to advance vehicle safety very late in the Obama administration. It started being promised about halfway through the Trump administration, and then was put out like 2 weeks or something before the end of that administration, and immediately withdrawn by the Biden administration. So we know that bicyclists and pedestrians have been being killed by large SUVs and trucks and these vehicles that are dangerous to them. And we haven't been doing anything about it for about a decade while we've known that. So I'd really love to see the administration take action on that through the new car assessment program, and including bicycle and pedestrian safety in that program for the first time in the United States would be really powerful. So yeah, that's my one.
Okay.
Thank you.
Well, let's see. For my side, I think there's 120 federal programs. Only a few of them are in DOT and report to National Transit Database, but the other ones don't. So that's one issue. But the second issue is too many of them subsidize separate ride networks. Veterans Affairs, different ride network. They subsidize a couple of them, but they're exclusive to veterans. Medicaid in most states doesn't play well with others. Non-emergency medical transportation is so important, but why should an EMT rider going in the same direction at the same time as somebody subsidized to go to a employment site for an adult with developmental disabilities be on a separate vehicle, and dialysis on ADA? If they're, I'd like to see, if you're competent to arrange your transportation, you're competent to choose your ride provider. That's where that mobility wallet comes in. Load those subsidies once a month, and that way you can develop neighborhood-based connections to those transit hubs, and within those neighborhoods, that'll meet your needs. The other one is, I live in South Carolina where we don't have continuous pathways on suburban collector and arterial roads. If the federal government's going to subsidize paving or repaving a road, they need to kick in and subsidize a continuous pathway. That's my thing.
I agree. Well, and I think, and thank you both. You know, what we've seen during the COVID pandemic is that, you know, people started walking more, working from home, riding bikes. Look at bicycle sales across the country and the world, and everything that a lot of naysayers said couldn't happen happened, and people did it. And we're hopeful that we have a lot more advocates out there now that got a taste of it and said, hey, I really like this flexibility I have, that I can walk and I can ride my bike and I have access, and knowing where in their community they don't have access, and how didn't that happen when the community was designed and planned. So I think that's hopefully a very exciting path going forward, that more people are engaged and involved in the process and how it impacts them. And we're hopeful with that. So thank you again. We really appreciate your time and both of your talents. And thank you. And thank you again to Lois and to Steve Ray for the support of their organizations. If you can see in the chat, this is our second webinar that we had put on. We have another one coming up April 21st. And we're still working on the speakers for that. So stay tuned on our website and social media for that as well. And if you need anything else, you can reach us at our website, 82alliance.com, excuse me, or follow us on Twitter. We're going to put this up on our YouTube account as well. So thank you, and really appreciate the time everyone took, and I really appreciate our speakers. Have a great day.
Thank you.
Thank you.
Thanks.
Thanks.
Thank you.
Bye, thank you.
Bye.